So I'm going to try to wrap this as proximal as I can without being a creep. So hopefully that's okay. Okay, so with this technique, you're going to do an inferior glide, hip adduction, and internal rotation. So the internal rotation is really strong. I am actually going to use the band as leverage and rotate her to the point where she's almost actually side bending. The inferior glide allows me to scoop and traction her hip at the same time. And then she's going to actively extend her knee and dorsiflex her ankle. So it's a active posterior chain hamstring stretch, posterior chain stretch. But since I'm adducting and internally rotating, it's also sciatic. Because to bias the sciatic nerve more than just, because you already felt it with only hip flexion, you add the adduction and internal rotation. I traction by going up from a hip hinging, going into a tall kneel. I'm holding the inferior glide. It's inferior. Yeah, this would be posterior. I'm doing an inferior glide. Yeah. Ready? So go ahead and just practice kicking up. That's what you're going to do. Okay. So when you do that, I'm going to do all those other things. Okay. I'm going to inferior. Oh, not yet. I was just recapping. Inferior glide, adduction, internal rotation, traction. Ready? Yep. Go. How's that feel? Okay.
Yeah, it's okay.
Okay, because I'm kind of
like that for
forever, because it's really hard to do this to yourself.
Yeah, pretty much.
Yeah. So this is my shotgun technique. If someone that still has hip issues and the lumbar loading either doesn't work or maybe only took them halfway. But before you felt it right here, I didn't even have to dorsiflex. How's it feel?
Better.
Good. So, because I would want to flex her a little bit more. Now you feel it. Yeah. But it's better because you only felt it without even the adduction and internal rotation. And then your hip flexion is way better, and your IR is actually way better, and your ER is actually luckily not as excessive. Because what I wouldn't want is her ER to stay excessive and then have more IR.